Good morning.
Good morning.
Like Bobby said, I'm Kelly, and I'm with the New Mexico Aging and Long-Term Services Department. And I'm here to talk to you about how to prevent Medicare fraud. And like Bobby said, I will be sure to send her copies of these slides so that they'll be available to anybody that wants them. So we're going to talk about what the Senior Medicare Patrol is, what are Medicare fraud, errors, and abuse, how to protect, detect, and report, and how to fight back against Medicare fraud. And we're going to talk about the scams and real life cases that we're seeing here in New Mexico. The SMP mission is to empower and assist Medicare beneficiaries, their families and caregivers to protect, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. The SMP is federally funded through the Administration for Community Living, or ACL, and there are SMPs in every state. We receive ongoing training from Medicare, and all services we provide are completely free. There are two types of Medicare coverage: Original Medicare or a Medicare Advantage plan. Both types can have fraud, error, or abuse issues, and both send summaries for review. Original Medicare is through the government, and a Medicare Advantage plan is through a private insurance company. And we'll go into more of this coming up. So what is Medicare fraud? These are some examples: billing for services, supplies, or equipment that were not provided, billing for excessive medical supplies, or obtaining or giving a Medicare number for free services. What is Medicare abuse? Abuse is practices that result in unnecessary costs to Medicare. And some examples are improper coding to obtain a higher payment, unneeded or excessive x-rays and lab tests, claims for services that are not medically necessary, using another person's Medicare number or letting someone use your ID number, misusing codes on a claim, or charging excessively for services or supplies. What about errors? Healthcare services and billing are extremely complicated, which can lead to errors. A review of the issue will determine if it's an error, fraud, or abuse. So most Medicare payment errors are simple mistakes and not the result of providers that are trying to take advantage of the Medicare system. Sometimes what seems to be fraud or abuse turns out to be a simple error that can be fixed by contacting the provider. It's important to report misused, stolen, or compromised Medicare numbers. Misused means you let someone use your Medicare number fraudulently. Stolen is obviously when someone steals your Medicare number, but this can be by someone that you know. We've seen cases where a family member has stolen a Medicare number of their loved one. Compromised is when your Medicare number is accidentally exposed, like giving it out to a telemarketer, any stranger, or non-provider. You should treat your Medicare number like a credit card number. What to check for fraud, errors, and abuse? With Original Medicare, you should review your quarterly Medicare summary notices, or MSN. With the Medicare Advantage plan, you should review the explanation of benefits, or EOB, which comes as you receive or after you receive services. And if you don't receive your MSN or EOBs, you should contact your plan as soon as possible and ask them to start sending them to you. There are 3 steps to prevent healthcare fraud or Medicare fraud: protect, detect, and report. Step 1 is to protect yourself from Medicare fraud and abuse. These are some do's and don'ts. Do treat your Medicare and Social Security numbers like a credit card number. Do watch out for identity theft, and be aware that Medicare will not call you. Don't give out your Medicare number except to your doctor or other Medicare provider. Don't carry your Medicare card unless you need it for an appointment. So you should always protect your Medicare card and ID number. Medicare will not call you. If they need anything, they will send you a letter. Do not give out your Medicare ID number over the phone, and beware of callers or emails or texts offering free medical tests or supplies. Nothing is free. And do not answer calls from callers that you don't recognize. Step 2 is to detect Medicare fraud and abuse. Again, always review your Medicare summary notice or explanation of benefits, and you should look for 3 things: charges for something you didn't get, billing for the same thing twice, or services that weren't ordered by your doctor. And you can also access your Medicare summary notices on medicare.gov by creating a secure online account. And you should keep records of your healthcare visits. And you can use the Senior Medicare Patrol healthcare tracker that you see here on the screen. It's a little notebook or journal where you can record your doctor visits, tests, procedures, anything that you have done, and you should take it with you to your appointments. Any questions that you ask your doctor about your health, you can write down the answers right there in your journal. And then you want to compare, it's a helpful tool. You want to compare your MSNs or EOBs to your journal to make sure that they're correct. So I'll be sure to send some of these to Bobby and the Senior Center for anyone that would like one. Step 3 is to report suspected Medicare fraud and abuse. So you should call your provider and find out, is there a mistake? You should gather your information like the MSNs or EOBs or itemized bills, and document all calls that you make, the dates, the times, the names, and what transpired. And if you're not satisfied with the response that you get, you should call us at the SMP and we can assist. And our contact number is 1-800-432-2080. And the most common scams that we see here in New Mexico are from telemarketing. Surprise, surprise, right? So like mainly we see compromised ID numbers. This is when a Medicare beneficiary gives out their ID number, usually to a caller claiming to be from Medicare regarding, for example, new ID cards, like a plastic or a microchip card. There's no such thing. Medicare is not sending out new cards. There are also durable medical equipment or DME scams. And that's when a Medicare beneficiary gives out their ID number to a caller offering DME. Sometimes they'll later receive by mail a DME item like a back brace or a knee brace that they didn't want or need, and their doctor did not order. In many situations, the victims of this scam have Medicare billed for this unnecessary item. There are also marketing scams. This is when so-called free services are marketed to Medicare beneficiaries, such as COVID tests, This is where the Medicare beneficiary gives out their ID number to a caller offering so-called free tests. Medicare gets billed most of the time. Sometimes the person receives the tests, sometimes they don't. Sometimes the tests are expired, but this is not free when Medicare gets billed. There are also marketing violations. And this is when a Medicare beneficiary gives out their ID numbers to a caller, usually a broker, wanting them to switch plans and promising extra or free benefits. Then they get switched to another plan, and as a result, they can lose access to their providers and life-saving medications. So if you hear of any of these types of scams, you should call us at the SMP. And I want to reiterate that Medicare will not call you. You can contact us at the SMP by calling the Aging and Disability Resource Center at 1-800-432-2080. This is our call center. So you want to be sure that you ask the representative to be put in contact with the SMP. You can also contact us by email, and our email is listed here on page 17. We also have web chat on our website, and the website is also listed here, and that's nmaging.state.nm.us. And you would just go on the website and click this button that says live chat, and that'll connect you to our lovely Roseanne, who monitors the web chat and will respond directly to your questions. Be sure to ask her for the SMP. So the beautiful thing is that it's a live person and it's not automated responses. You're getting our wonderful Roseanne. And if you want to learn more about aging and long-term services, we have a YouTube channel where we have workshops posted, tutorials, and all kinds of good stuff, such as this presentation that you're seeing today. And that channel is ALTSD New Mexico State. And for the latest aging and long-term services news, you can follow us on Facebook and Twitter. And you can help us improve our programming by taking our survey. It's completely anonymous, and there's only a few questions. It takes only a couple of minutes to complete, and the website here is on page 20. And this is where you can let the feds know how we did today. And again, I'll be sure to send these slides over to Bobby so you can get a copy of all this information. And wrapping up, remember the 3 action steps